Our next presentation is a case study from the University of Pittsburgh Medical Center, UPMC for short, the #1 ranked hospital in Pittsburgh. And it's also one of this year's Inspiring Workplaces Award winners in both North America and globally. This is a pre-recorded session, but we have two presenters. We have Joe Dicianno, who's the Director of Talent Management and Organizational Development at UPMC. He's also an author of A Busy Leader's Guide to Caring Leadership. He's a leadership coach and an adjunct professor at the University of Pittsburgh for People Analytics. Joe's passion for leadership is a driving force, but with his work in talent management. Joe and his team at UPMC have won several awards, including multiple years at Inspiring Workplaces, for workplace culture, leadership, executive development, and employee listening. And he'll be joined by LaShana Stokes. She's an experienced transformational leader with 27 years in higher education and most recently the healthcare industry. As Chief of Staff at UPMC, she serves as a liaison to the Chief Diversity, Inclusion, and Talent Management Officer. One of her top priorities is establishing collaborative and working relationships to identify needs, design plans, and identify intersections. She's received numerous awards in higher education for her research on piloting first-year experiences, specifically for underrepresented populations, and in the healthcare industry for promoting diversity, equity, and inclusion. She's also presented at regional, national, and international conferences on these topics. So Joe and LaShana are going to be discussing how life-changing medicine requires life-changing experiences. Let's learn what they have to share with us.
Good afternoon from Pittsburgh today, everyone, and good morning, good evening to those of you around the world. My colleague and I are pleased to spend the next 15 to 20 minutes with you to share a little bit about our life-changing organization, UPMC. We're also going to share some best practices that led to our second Inspiring Workplaces Award in 2024. My name is Joe Dicianno, and I'm a Director of Talent Management and Organizational Development. I've been at UPMC for over a decade, and man, does time fly.
And greetings, everyone. My name is LaShana Stokes. I'm Chief of Staff of Diversity, Inclusion, and also Talent Management. So before we get into the details behind our Inspiring Workplaces Award, we're going to take a few minutes to share about who UPMC is. This context is really beneficial as it relates to the best practices that we're going to be highlighting for you today. UPMC is a world-renowned nonprofit healthcare provider and insurer committed to delivering exceptional people-centered care and community services. Headquartered in Pittsburgh and affiliated with the University of Pittsburgh Schools of the Health Sciences, UPMC is shaping the future of health through clinical and technological innovation, research, and education. Dedicated to advancing the well-being of our diverse communities, we provide nearly $2 billion annually in community benefits, more than any other health system in Pennsylvania. Our 100,000 employees, including more than 5,000 physicians, care for patients across more than 40 hospitals and 800 outpatient sites in Pennsylvania, New York, and Maryland, as well as overseas. UPMC Insurance Services covers more than 4 million members, providing the highest quality care at the most affordable price. And we really are driven by an unwavering focus. And what drives that focus is our mission and vision. And our mission is simply this: to serve our communities by providing outstanding patient care and to shape tomorrow's health system through clinical and technological innovation, research, and education. And here's our vision. UPMC will lead the transformation of healthcare. And how are we doing this? Well, the UPMC model is nationally recognized for redefining healthcare by putting our patients' health plan members, employees, and community at the center of everything we do, and creating a model that ensures that every patient gets the right care in the right way, at the right time, every time. Harnessing our integrated capabilities to deliver both superb state-of-the-art care to our patients and high value to our stakeholders, serving the underserved and disadvantaged, and advancing excellence and innovation throughout healthcare. and fueling the development of new businesses globally that are consistent with our mission as an ongoing catalyst and driver of economic development for the benefit of residents of the region. And our values are the standards of behavior that guide our culture. It ensures the importance is equally placed on what we do as well as how we do it. And US News and World Report consistently ranks UPMC Presbyterian Shadyside among the nation's best hospitals in many specialties. It's also ranked #1 in Pittsburgh. Additionally, UPMC Mercy is nationally ranked for excellence in rehabilitation, and UPMC McGee Women's is nationally ranked for excellence in obstetrics and gynecology. And life-changing is just this: compassionate, expert care, a welcoming environment, help for anyone who needs it, especially those who need it most. And at UPMC, we strive to change people's lives for the better in any way that we can, from offering the latest treatments to providing community support. We are committed to delivering life-changing medicine every day and are recognized nationally for doing such.
Thanks, LaShana. Our values drive our culture, and the culture builds the UPMC experience. A little more about what we mean by this statement. UPMC is a social enterprise with a quadruple aim. The first of these is our patients. Every single patient that enters our hospitals and doctors' offices expects the best quality care, and they expect the best experience, and they expect the best cost. And they expect the same whether it's a child with a scraped knee visiting our world-renowned children's hospital or an adult having the worst day of their lives, and we are now responsible for their care. The second piece of this quadruple aim is our members. Our unique payer-provider model offers us unique advantages. It also takes that support of our patients a step further, where they expect the best support of their wellness and well-being holistically. The third is our employees. Our over 100,000 employees make our vision possible. The way we treat our employees and the way they treat each other is the way that they will treat our patients. That's why our UPMC values are so important. And lastly, the communities. We are not only responsible for bringing world-class care to these communities we create jobs, build partnerships, charitable contributions, and impact these communities in a variety of positive ways. Now we're going to spotlight a few of our best practices that led to our second Inspiring Workplaces Award. The first of these is our employee listening strategy. This is important because many of the cultural and employee-based metrics that we use to measure our employee experience come from our employee listening strategy. Our culture survey called MyVoice, paired with other surveys that we need to do, such as culture of safety, make up the linchpin of our employee listening strategy. We also are looking at new hire experience and offboarding experience surveys to roll into this portfolio in 2025. What makes this employee listening strategy unique and a best practice is a couple of tactics that I would like to share with you today. The first is a maturity model. For years, we've followed a purposeful path in developing and enhancing our employee listening strategy to ensure that it leads to action. This maturity model gave us a roadmap to prepare for the future and to push our organization forward as it relates to creating action based on the valuable insights from our employee listening platform. Second is branding. MyVoice has become a strong brand, a brand that is associated with our vendor so that we are upfront and clear that these employee listening strategies are confidential and protected. The third one is fairness. We ensure that we make decisions around the process that are as fair as possible when holding leaders accountable to participation and employee engagement scores across the organization. One way that we make the participation fair is by removing the terminations and leave of absence during the survey window to ensure that they're not reflected negatively in the participation scores. Next is simplicity. We want our reports to be so simple and consumable to our frontline employees that it allows them to go right into action. Next is variety. We have a variety of statements within our survey and indices that measure things like organizational care, team care, well-being, how well are our employees set up for success to bring their best selves to work. We also have a one-stop shop where leaders are not going to 4 different systems to get 4 different results. A big problem in today's leadership landscape. They can go to one portal to get results for all of these employee listening strategies in one place. Next is plausible deniability, as I call it. That is an opportunity for us as a centralized system-wide team to remove all of the barriers that leaders might have when it comes to creating action, so that they're not stuck in limbo wondering, what do my results mean? What is most important to focus on from my results? What do I do next? We provide resources and wraparound support for our employee listening tactics to help remove those barriers and get them right to action. Next is executive support. This always goes without saying. If your executive team and the leaders of your organization don't care about the results that you're getting and turning those into action, then that will never happen. So that's incredibly important. Lastly is our 4-way infrastructure. We empower all 4 of our infrastructures are our leaders, human resources as a key strategic business partner, our employee experience committee, and then lastly, our communications team that uses communications that are centrally focused on the theme that life-changing is being a powerful force in your employee experience, force in shaping the member experience, and a powerful force in shaping the patient experience.
Thank you, Joe. UPMC was ranked in the top 100 inspiring workplaces in North America, and we received special recognition for our work in diversity, equity, and inclusion. And recently, we've been recognized as one of the top inspiring workplaces now globally. And at UPMC, our commitment to providing culturally competent care means that we understand that knowledge and responsiveness to diverse languages, communication patterns, and health belief systems are key to our ability to take accurate medical histories, make diagnoses, and ensure our patient and member understanding and treatment adherence to provide healthy lifestyles. It also means that we equipped our staff with the tools and resources needed to provide quality services to new and existing members with widely varying needs. In the next few slides, I'll be sharing more in depth about our commitment to diversity, equity, and inclusion, and how each one is intentionally weaved into the fabric of what we do on a daily basis. And we're very proud of the work that has led us to this recognition. So at UPMC, diversity, equity, and inclusion is built in to our overall business strategy and culture with a strong diversity infrastructure. The UPMC Board Inclusion and Diversity Committee provides governance and serves as the Inclusion and Diversity Policy Advisor to UPMC's executive leadership. Executives report out on diversity initiatives and goal progression on a quarterly basis. UPMC's diversity, equity, and inclusion agenda is spearheaded by the Center of Engagement and Inclusion. Local division, department roles, system, and location-specific employee experience teams, and the Community Health Partnership Council also serve as partners. UPMC also has 11 system-wide employee resource groups, which we call ERGs, serving as a forum for community building and providing input to improve employee, patient, and community experience. At UPMC, diversity, equity, and inclusion is how we achieve our mission and also grow our business. UPMC's diversity and inclusion agenda focuses on 4 key areas. As you see there on the screen, workforce, culturally competent care, community, and marketplace. And our agenda seeks to address national disparities identified in employment, health, and the community. Human capital analytics identify the most meaningful experiences employees have with us by way of measurement, transparency, and also accountability. Each quarter, our CEO, executives, and other leaders receive a scorecard with the most updated employment information based on gender, race, ethnicity, including who was hired, performance review assessments, retention, retirement eligibility, promotions, turnover, and transfers. And analyzing these employee life cycle metrics helps senior executives to identify potential disparities, address systematic inequalities, and implement targeted initiatives to evaluate and improve the employee experience. Workforce diversity and employee representation are critical for us. We know that by having a diverse workforce, we become an organization of better critical thinkers and problem solvers, and one that is more creative, agile, and innovative in our approach to delivering high quality care. We believe that our workforce should reflect the demographics of the communities that we serve, and that our executives should reflect the demographics of our workforce. From 2016 to 2021, UPMC increased people of color and women in executive roles by 96% and 19% respectively. And in recognition of our workforce representation goals, strategies, and successes, UPMC was a 2023 Catalyst Award winner. And by 2026, the workforce goal is to increase representation of people of color and women in executive roles by 40% and 20% respectively, and to increase representation of women and people of color in service worker, professional, technician, and mid-level job categories, representing over 80% of our workforce, to mirror or exceed healthcare and social assistance regional labor data. And as part of our annual mandatory learnings and the performance evaluation process, UPMC requires 2 self-paced diversity, equity, and inclusion courses for employees each year. Self-paced courses on the foundations of diversity and equity and inclusion, microaggressions, and unconscious bias are facilitated monthly to equip employees with the skills and knowledge to ensure best patient care delivery, customer, and workplace best practices. Learning forums are provided on an ad hoc basis. And enriching the health status of those who live and work in the communities we serve is really, really important to UPMC, which is why we invest in our community in meaningful ways. We provide culturally and linguistically competent care to improve the health status of our patient and member population by employing various processes, learnings, resources, and partnerships to ensure we are developing skills for communication and interactions across cultures, gaining knowledge of different cultural practices, developing positive attitudes toward cultural differences, and being aware of one's own worldview. We also partner with nonprofit organizations, charitable foundations, educational facilities, government agencies, and faith-based organizations to promote health equity and address disparities affecting the diverse populations in the communities we serve through various coordinated efforts across UPMC.
Our last best practice highlight is our development ecosystem, as I call it, offering a variety of programs that are available to leaders and staff. Thinking about staff and all of their diverse needs, we offer a LinkedIn learning catalog of tens of thousands of courses already curated to upskill our employees on a variety of topics that express them as a whole person, not just as a professional. Second, we have a physician-specific learning cohort-based program called Physician Leadership Essentials that has sent hundreds of physicians through over the last couple of years, training them on essential skills that they need as a leader and the business acumen needed to pair with their expertise in the medical field. Next, we have leader-specific trainings. Whether you are a new leader in Attend Drive, embracing leadership that all new leaders are required to attend, or attending a number of our leadership programs outside of that, we want to ensure that leaders are learners continuously, and we are providing the programs and framework that support that. Next, we have a variety of pathways and podcasts to ensure that we're supplementing those leadership programs with some informal learning activities. Learning pathways, ways to invest in your future on a self-paced way while exploring many different topical areas on a number of leadership topics, psychological safety, team performance being two examples. Our Lessons to Lead podcast highlights key leaders across the organization and allows them to share from the front lines of healthcare what their experience has been and share tips and tricks to our other leaders across the organization, creating a social learning component. Lastly, our capstone leadership program called Leadership Development Intensive, or LDI, is designed to turn top talent directors into future executives. This is a comprehensive cohort-based program happening every other year that has created a valuable pipeline of directors who are now running UPMC at all facets of the organization.
And thanks to each of you for joining us from around the world. Again, my name is LaShana Stokes.
I'm Joe Dicianno. Thank you so much for having us. If you'd like to connect with us more on LinkedIn, we'd be happy to connect and chat more about our best practices and UPMC.